Hi, my name is Julian Nalis, and this is my video validation for IVPB back and changing of the gown. The first thing I'm going to do is state the 7 steps with our check the physician's orders, wash my hands, identify the patient, introduce myself, explain the procedure, gather my equipment, and provide privacy. Then I'm going to go over to the patient. After I wash my hands and check the physician's orders, I'm going to go over to the patient. I'm going to assess the IV site for any redness, swelling, or patency. And then I'm going to go back to the med room and I'm going to prepare the IV. The first thing I'm going to do is get the proper IV solution. I'm going to make sure it's not expired. I'm going to put a timestamp label on it with my name, the date, and the time that it's supposed to start and finish. Then I'm going to get the primary tubing. And the first thing I'm going to do is untangle it. And I'm going to make sure that the clamp is closed and moved up. Then I'm going to remove the tops of the IV and remove the tops of the needle. I'm going to insert into the IV solution. Twist it on there. Then I'm going to hang it. I'm going to fill my drop chamber. Okay. I'm going to remove the cap to the tubing. I'm going to keep it upward so it stays sterile. I'm going to keep the tubing above my waist. I'm going to open the clamp and prime the line. Okay. Now the line is primed, I'm going to put the cap back on the tubing. And then I'm going to go and I'm going to clean the heparin lock on the patient with an alcohol swipe. And then I'm going to insert the tubing into the port, except for the purpose of this validation. I'm going to use the basin so that doesn't get wet. And then I'm going to calculate the drip rate, and I'm going to do 60 drops per minute, which is going to be 15 drops per 15 seconds. Okay, that's 15 drops in 15 seconds. When I am inserting the port, I will be wearing gloves for protection. And then I'm going to remove my gloves, wash my hands, and record on the I&O sheet. And then I'm going to lower the bed to the lowest position, make the patient comfortable, and put the call bell button and reach in case he or she needs me for anything. Then I find out that the doctor wants medication added to the IV, so what I'm going to do is I'm going to go and I'm going to assess the primary tubing line, make sure that there's no redness or swelling or patency. And then I'm going to check the medication record with the physician's order, and then I'm going to go and make sure I have the proper medication IV, and I'm going to say my 6 rights, which is right dose, right drug, right reason, right route, right patient, and right time. And then I'm going to make sure it's not expired, and I'm also going to stamp a tubing label onto it. And then I'm going to check it with, I'm going to check this medication with the MAR that the doctor ordered. And then I'm going to get the secondary tubing ready. Going to untangle this, and then I'm going to remove that. Then I'm going to hang the secondary. I'm going to fill the drip chamber halfway. And I'm going to prime the tube. Prime the line. I'm going to attach my IV to the patient.
Calibrate my trips. I'm going to calibrating 6 drops per minute, that's 15 drops.
Then I'm going to lower the primary tubing. And then I'm going to clean the port to the primary tubing with an alcohol swab. And then I'm going to attach the piggyback port to the primary tubing. And I'm going to open it all the way. And then I'm going to recalibrate the secondary tubing in with the primary tubing with the drip rate. And then I'm going to remove my gloves. I'm going to wash my hands again. And then I'm going to put the bed down and make the patient comfortable. I'm going to put the call bell button in reach. And I'm going to leave the patient for a half an hour. And then after that, I'm going to come back. Before I leave, I'm going to wrap this around the tubing for the tubing change. And I'm also going to add a medication added sticker to the primary tubing. Then, after a half hour, I'm going to come back and I'm going to close this. And then I have to recalibrate the primary tubing back to where it's 15 drops per minute. And then I'm going to change the patient's gown. What I'm going to bring him up to my working height. I'm going to put gloves on, just in case the make sure that the new gown and the soiled gown don't touch. I'm going to keep the patient covered at all times. I'm going to put his arm through.
Then I'm going to get gloves again. I'm going to sterilize my primary fork.
IVs down. I'm going to put them through very gentle with the IVs. And then I'm going to rehang these. Careful not to expose the patient. Okay, and then I'm going to throw my soiled linens into the soiled linens bin. Okay, and that completes my video validation.